A wisdom tooth is a third molar. In Hindi, it is called akaldar. It is the molar that erupts last in your mouth. There is no particular age for the wisdom tooth to erupt. It can come as early as when you're 16 or 17. I have also seen patients getting their wisdom teeth up to the age of, say, 35, 40, and beyond. Now, the problem with wisdom teeth is they have no space in the arch because all the other teeth have taken up all the space. So, in most people, they tend to cause a problem because they come out somehow from whichever direction they get, and that is what leads to a problem in most people. One of the first symptoms that you'll get is difficulty in chewing. So when you're chewing or biting, you'll feel a swelling at the back of your mouth in this region. So every time you bite or chew, the gums are inflamed over there because the tooth is pushing from inside and trying to come out. And then when you're chewing, your gums get compressed in between. And that is what causes the kind of a swelling, discomfort, painful situation in that region. So that is usually one of the first symptoms, followed by pain. This pain, in some cases, if it is a lower wisdom molar, can radiate all along your jaw and even on your neck up to your shoulder. In an upper wisdom molar, it can radiate to your head and even cause a headache and swelling in some cases as well. Usually, the rule of the thumb is if you've had to take painkillers and antibiotics more than twice for one wisdom tooth, it is an indication to get it removed. Yes, there are some home remedies. If you are unfortunately stuck somewhere that you cannot visit the dentist immediately, you can try doing warm water salt rinsing. That really helps with the swelling and inflammation. You can try putting a little bit of clove oil over there to soothe that area. But these are all temporary reliefs. It will give you relief for a few days. But if the wisdom molar is still there and its position is still like that, the pain and discomfort will come back. If you are repeatedly having to take painkillers, antibiotics to soothe that discomfort, it is an indication that you need to visit your dentist and consider getting it removed. In some cases where the wisdom tooth is very badly impacted, like if it is placed horizontally or if it is pushing on your adjacent teeth, it is a good indication to get it removed. In some cases, when it is tilting onto the adjacent teeth, it can also cause decay or cavity on the adjacent teeth. In some people who already have crowded teeth, the eruption of wisdom molar makes the crowding worse. In such cases, it is better to plan and get it removed rather than ending up in severe pain and rushing to the emergency. It is said that a wisdom tooth pain it can be very, very bad. It is like an emergency. You cannot sustain it. You have to take painkillers or rush to your dentist and get it removed. As for the surgery, it is a minor surgical procedure. It is done under local anesthesia. If it is a lower wisdom molar, there is more discomfort as compared to an upper wisdom molar. You will have some swelling, some discomfort for a day or two, but after that it subsides. One of the funniest things that I sometimes hear in my clinic is people come and ask me that if we remove our wisdom tooth, will we lose our eyesight? So I want to make it very clear that your wisdom teeth has nothing to do with your eyesight. Nothing is going to happen to your eyes if you get your wisdom teeth removed. If it is bothering you, repeatedly causing a swelling, pain, infection, or damaging the adjacent tooth, or causing crowding, it is a good idea to get it removed. Also, because it is very difficult to maintain that area. Your toothbrush cannot go till here. And more often than not, we see patients with a lot of cavities and decay in that area just because they cannot clean that area and food goes and gets stuck over there. So no, there are no side effects as such. Again, if it is done by a qualified, experienced oral surgeon who is an expert in this field, there's nothing one needs to fear. After the surgery, we always give a gauze or a cotton pack, which needs to be kept for half an hour to 40 minutes, following which the patient should ideally consume cold things. So we generally recommend them to have a soft ice cream. For the first 24 hours, they cannot rinse or spit out. Because if you repeatedly rinse and spit after a surgery, your bleeding will increase. So you may get a little saliva, a little blood in your mouth, which you need to swallow. You need to be on a soft diet for the first 24 hours. and you should not consume anything very hot. So if you are having tea, coffee, or anything like that, make sure that it is cooled down to room temperature. You are having soft things like rice, dalia, khichdi just for one day. You're not having something very hot, hard, or spicy. If you're a smoker, you should completely avoid smoking for the first 48 hours. Alcohol consumption is not advisable. After the first 24 hours are over, you generally visit your dentist to see that everything is fine. After that, your dentist may recommend you to start a warm water salt rinsing, which you should definitely start. It will help you with the swelling and inflammation. Another thing which you can do on the first day, we generally give an ice pack in our clinic after the surgery. You can continue to apply the ice pack from the outside. That also helps with the swelling and discomfort. So these are some few small measures or steps which you can take, which will help in, healing after the surgery.